Hello to all the amazing seniors, the trailblazers, and the legends watching across America. Welcome to our channel, the place where we believe the best years of your life aren't a memory, but something you're living right now and what's still to come. But I want to start with a question that might be a little startling. What if I told you that some of the most common medical practices, the very things you believe are key to staying healthy, could actually be harming you after the age of 70? That's right. There are 5 incredibly common medical tests that, after a certain age, might be doing more harm than good. These tests can send you down a rabbit hole of anxiety, painful procedures, and draining treatments you never actually needed. Knowing what these are isn't just information, it's your shield. Before we unpack this crucial medical secret, help me do something very quickly. If you believe everyone deserves to age with dignity and joy, please hit the like button for this video. Type, "I'm ready to live better" in the comments below to cheer each other on. And most importantly, click that subscribe button and ring the notification bell. Why? Because our mission is to empower you, and you don't want to miss a single one of our life-changing tips. Done? Fantastic. You've just joined a movement. Before we get to the list, let's talk about a fundamental paradigm shift. For most of our lives, the goal of medicine is longevity. We do whatever it takes to add years to our life. But after 70, 75, or 80, a wise doctor will tell you that the goal shifts from lifespan to health span. The goal is no longer just about adding years to your life, but about adding life to your years. It's about quality, function, joy, and meaning. It's about making sure you can keep playing with your grandkids, tending to your flower garden, traveling, or simply enjoying a morning cup of coffee without the pain and fatigue of aggressive, unnecessary medical treatments. Remember this as we discuss each test. The question isn't, can this test find something? The question is, will finding that something actually help me live a better, happier, more independent life? And stick with me to the very end, because I'm going to share the ultimate question, just 9 simple words that you need to ask your doctor before agreeing to any test or procedure. This question will change the dynamic of the conversation, put you in the driver's seat, and ensure your care truly aligns with your wishes. It's the most powerful tool in your healthcare advocacy toolkit. Let's begin. Number 1. Routine mammograms for breast cancer after age 75. The mammogram. For decades, it's been hailed as a hero in the war on breast cancer, and for women from 40 to 70, it has been an undisputed lifesaver. But what happens when a woman celebrates her 75th birthday? The facts. The country's most respected panel of experts, the U.S. Preventative Services Task Force, states there isn't enough evidence to recommend routine screening mammograms after age 74. This isn't because they don't care, but because they see a dangerous shift in the balance of risk versus benefit. The hidden risk. The main problem is overdiagnosis. Imagine this. Inside you, there's a patch of breast cancer cells growing so slowly, like a snail. It's so sluggish that you would most likely live to be 95 and pass away peacefully in your sleep from something else entirely, never even knowing it was there. But the mammogram finds it. The alarm bells go off. Suddenly, you're pushed into a cascade of intervention, a painful biopsy where a large needle is inserted into your breast, then perhaps a lumpectomy or mastectomy, followed by weeks of radiation that burns your skin and leaves you with a bone-deep fatigue that makes it hard to walk to the kitchen, not to mention the side effects of hormone therapy. All of this for a cancer that was never going to hurt you. The treatment, ironically, robs you of the very quality of life you treasure. Let's talk about Eleanor, a retired 82-year-old librarian from Vermont. Her world was her books, her Wednesday knitting club, and her morning walks with her golden retriever, Buddy. When her doctor suggested a routine mammogram, Eleanor felt a knot of anxiety. She remembered her friend, Marge, who went through the whole breast cancer treatment ordeal at 80 and never really bounced back. She lost her spark. Eleanor went home, sat in her favorite armchair petting Buddy, and made a list. On one side, possibility of finding a cancer. On the other, risk of fatigue, pain, losing my independence, not being able to knit, not being able to walk Buddy. She took that list to her next appointment. "Doctor," she said in a quiet but firm voice, "I am more afraid of the treatment than I am of the disease. Can we focus on keeping me strong and happy just as I am right now?" Her doctor was silent for a moment, then smiled. "Eleanor," he replied, "that's the best medical goal I've heard all day." They decided to forego the routine mammogram and focus on clinical exams. Eleanor felt at peace. She had chosen her quality of life. Your practical tips. Understand your values. What is most important to you on a day-to-day basis? Ask your doctor. What are the chances a mammogram at my age will find a life-threatening cancer versus a slow-growing one? And if we were to treat it, what would my day-to-day life look like during and after that treatment? Number 2. Routine colonoscopies for colon cancer after age 75 to 80. The colonoscopy is the gold standard for detecting colon cancer. There is no doubt about that. And if you are 50 or 60, it is a profoundly important procedure. But again, the clock ticks and our bodies change. The facts. Most medical guidelines suggest reconsidering routine colonoscopies after age 75, and generally do not recommend them after 85 unless there are high-risk factors. Why? Because the risks begin to overshadow the benefits. The first risk, the PrEP. For an 80-year-old, drinking a gallon of powerful bowel cleansing solution is not only unpleasant, it's dangerous. It can cause severe dehydration, electrolyte imbalances that can affect your heart, and even falls in the middle of the night from rushing to the bathroom. Secondly, the risk of the procedure itself increases with age, and older colon becomes thinner and less flexible. The risk of perforation, a hole or tear in the bowel wall, though small, becomes more real. A perforation is a medical emergency, requiring major surgery, and can be life-threatening. Additionally, there are risks of bleeding and complications from the anesthesia. Remember, most polyps take 10 to 20 years to become cancerous. If you're 80 and healthy, finding and removing a small polyp is unlikely to extend your life, but a complication from the procedure could shorten it or drastically reduce its quality. Frank, a 78-year-old Marine Corps veteran, was a no-nonsense kind of guy. "If there's a problem, you fix it," was his motto. So he'd always had his colonoscopies every 10 years. But when the next one was scheduled, his wife Clara voiced her concern. Their neighbor, a healthy 81-year-old, had suffered a bowel perforation during a colonoscopy and spent 2 months in the hospital and a rehab facility. He never returned to being the same man. Frank, who prided himself on his independence, was horrified by the thought. He and Clara sat down and researched the alternatives. At his appointment, Frank said to his doctor, "Doc, I've served on the battlefield. I'm not afraid of much, but I am afraid of losing the ability to take care of myself and my wife. I'm not willing to take the risk of this procedure anymore. What are our other options?" They discussed non-invasive, stool-based tests like FIT or Cologuard. They agreed this was a more sensible approach for Frank at his stage of life. He wasn't rejecting healthcare, he was choosing wiser healthcare. Your practical tips. Be honest about your risk tolerance. What's scarier, the future risk of disease or the immediate risk of a procedural complication? Ask your doctor. Given my age and overall health, does the potential survival benefit of another colonoscopy outweigh the immediate risks of the prep and the procedure? Let's talk about the numbers. Number 3, routine PSA screening for prostate cancer after age 70. All right, gentlemen, this one's for you. The prostate-specific antigen, PSA blood test, is perhaps one of the most controversial screening tests in all of medicine. The facts. Much like the mammogram, most major medical organizations no longer recommend routine PSA screening for men over 70. The reason is powerful. The test is far more likely to cause harm than good. The hidden risk. Prostate cancer is a strange disease. The vast majority of cases in older men are incredibly slow-growing. So slow, in fact, they are often nicknamed the turtles of the cancer world. Most older men die with prostate cancer, not from it. The problem with the PSA test is that it can't tell the difference between a harmless turtle and an aggressive rabbit. A high result triggers anxiety and almost always leads to a prostate biopsy, a procedure where multiple needles are shot through the rectal wall into the prostate gland. It can be quite painful and carries a real risk of serious infection. If one of those turtle cancers is found, you're faced with a terrible choice: surgery to remove the prostate or radiation. Both treatments carry a very high risk of permanent, life-altering side effects, urinary incontinence, and erectile dysfunction. Think about that. To treat a cancer that was likely never going to hurt you, you could lose two of the most fundamental functions for a man's dignity and intimacy. George, a 76-year-old retired engineer, was always a logical man. When his PSA came back slightly elevated, he approached it like an engineering problem. He made a spreadsheet. In one column, he wrote treatment. The potential side effects were urinary leakage, wearing adult diapers, no more intimacy with his wife of 52 years. In the other column, he wrote active surveillance, monitoring the problem closely without immediate treatment and maintaining his current quality of life. He took the spreadsheet to his urologist. "Look," George said, "logically, sacrificing everything I enjoy now to eliminate a theoretical risk in the future seems like a bad trade. I choose my quality of life." His urologist, accustomed to patients demanding, "Do something," was impressed. They agreed on the path of active surveillance. George felt empowered. He wasn't giving in to a disease, he was refusing to give up his life. Your practical tips. Important. If you have symptoms, trouble urinating, blood in urine, this is a different story. You need a diagnosis, not a screening. Ask your doctor, if my PSA is high and a biopsy finds a low-grade cancer, is active surveillance an option for me? What makes someone a good candidate for it? Number 4. Routine pap smears for cervical cancer after age 65. Ladies, this one is a piece of good news backed by science. The pap smear has been a tremendous victory for women's health, drastically reducing deaths from cervical cancer. You've done your part, getting this test dutifully for decades. The facts. The American Cancer Society and other organizations now clearly state that women can stop screening for cervical cancer after age 65, provided they have a history of normal results for the previous decade. The hidden risk. Continuing unnecessary tests is not without risk. While the risk is lower than the other tests we've discussed, a false positive can still occur. This can lead to needless anxiety and follow-up procedures like a colposcopy, examining the cervix with a microscope, and biopsy, which can be uncomfortable and cause bleeding or cramping. The logic is simple. Cervical cancer is almost always caused by the HPV virus. It takes many, many years for an infection to develop into cancer. If you've been regularly screened with normal results, and especially if you're in a long-term monogamous relationship, your risk of developing cervical cancer later in life is incredibly, vanishingly small. In essence, you've graduated from this test with flying colors. Maria, a vivacious 72-year-old grandmother who taught a salsa class for seniors, laughed when her new gynecologist mentioned a pap smear. "Honey," she said with a twinkle in her eye, "I have danced past that age." Instead of being embarrassed, her doctor smiled. "You're right," she said. "Let's check your records." After seeing her long history of normal results, she agreed. "You have absolutely graduated. Our time and energy are better spent keeping your bones strong for all that dancing." For Maria, it wasn't just about skipping a test. It was an acknowledgement that she had taken good care of her body, and now she could focus on enjoying the fruits of her labor. Your practical tips. Know your history. If you've ever had abnormal results or treatment for cervical dysplasia, the discussion may be different. Ask your doctor. "Based on my clean history and the current guidelines, can we confidently say I've completed my need for cervical cancer screening?" Number 5. Routine screening for bacteria in urine without symptoms. This last one may be the most common and most misunderstood of all. How many of us have been routinely asked to provide a urine sample at the doctor's office, even when we feel perfectly fine?
The facts. This is an incredibly common practice, but for older adults, it's often a harmful one. As we age, it is extremely common for bacteria to live peacefully in our bladder. This is called asymptomatic bacteriuria, bacteria without symptoms. They are quiet neighbors, not noisy intruders. The hidden whisk. The problem is, when we test for and find these bacteria, the ingrained medical reflex is treat it. This leads to a flood of unnecessary antibiotics. Why is this so bad? First, these antibiotics provide zero benefit in this situation, but they come with real risks. Nausea, diarrhea, and most frighteningly, they can kill off the good bacteria in your gut, paving the way for a superinfection called Clostridioides difficile, C. diff. C. diff causes severe, unrelenting diarrhea, dehydration, and can be fatal in older adults. Second, every time we use an unnecessary antibiotic, we contribute to the global crisis of antibiotic resistance, creating superbugs that our medicines won't be able to treat in the future. We must protect antibiotics like a precious resource. Robert, an 88-year-old great-grandfather, was a bit confused one morning at his assisted living facility. A well-meaning nurse immediately got a urine sample, which of course was positive for bacteria. A prescription for an antibiotic was ready. But Robert's daughter, Sarah, who had watched video just like this one, called immediately. "Wait," she said, calmly but firmly, "please, before we give him an antibiotic, can we just try something else? Let's make sure he drinks 2 full glasses of water. Let's take him for a walk down the hall. Check his other medications. Let's treat my dad, not his lab result." The staff agreed. Within a few hours, after being hydrated and moving a bit, Robert's confusion lifted. He was just mildly dehydrated. Sarah had saved her father from a potentially dangerous course of antibiotics and taught the staff a valuable lesson in person-centered care. Your practical tips. The principle is treat the person, not the paper. If there are no symptoms, no burning, no increased frequency, no fever, don't go looking for trouble. Ask your doctor or nurse, "Since I don't have any symptoms of a urinary tract infection, what is the medical reason for testing my urine today? What are the potential harms of doing so?" So, there you have them. The 5 tests: mammograms after 75, colonoscopies after 75-80, routine PSA tests after 70, pap smears after 65, and urine screenings without symptoms. The message I want to leave you with is not that medical tests are bad, They are not. The message is that you are the world's leading expert on yourself. You are the captain of your ship. Modern medicine is a wonderful tool, but a tool must be used wisely. Aging gracefully doesn't mean refusing care. It means demanding wise care. Care that honors your goals, your values, and your quality of life. And now, for the promise I made at the beginning, the most powerful tool you can use to make that happen. The next time a doctor suggests a new test, a procedure, or a medication, I want you to take a deep breath, look them respectfully in the eye, and ask this simple but profound question. These 9 words change everything. It stops the momentum of the do-something reflex. It stops on the momentum of the do-something reflex. It forces a pause. It opens up an honest conversation about the best and worst case scenarios of both action and inaction. It tells your doctor that you are a partner in this decision, not a passive passenger. Your life is a masterpiece. Don't let fear or habit or pressure paint it for you. Hold the brush firmly. Make bold choices. Choose joy. Choose meaning. Choose life. Thank you for spending your valuable time with us today. Please share this video with someone you love. It might be the most important conversation they have about their health this year. Don't forget, you are a part of this community now. We read every single comment. Until next time, remember always, keep living boldly.